Wait lang ha. Keynote. Natin keynote card. Okay, good afternoon. Hello, good afternoon.
Good afternoon po.
Good
Yes,
afternoon po, Doc.
yes, good afternoon. Clear ba yung voice ko?
Yes
Yes
po.
po.
Yes, thank you for patiently waiting for the technical difficulties. I'm sorry for that. So let's start. So for this afternoon, we're going to talk about the vector-borne diseases. So this is one of the subject discussion for your CPH. And then kanina umaga, I also discussed about the STD and the HIV. Okay, so let's start for the vector-borne diseases. So what are vector diseases? Okay, so from the word vectors, so this is a these vectors are the vessels. Ito yung dahilan kung bakit nagkakaroon ng disease yung isang tao. So vectors are living organisms that can transmit infectious diseases between humans, meaning can be humans to humans or from animals to humans. Okay. So ito yung these vectors, sila yung nagtatransmit. So, meaning they are the carriers of these infectious agents. Okay. Sila yung may dala, carrier. So, usually these vectors are arthropods, mosquitoes. Yan, common na nakikita natin na mga carrier ng organism ay yung mga mosquitoes. Common yan sa atin dito sa Philippines. Okay. So, some of the vectors are rodents. Okay. These vectors are infected vectors o carrier. Hindi naman kasi lahat ng lamok ay carrier. Okay. These vectors, meron din silang um, sila yung may daladalang sakit. Okay? Kaya sila yung may daladala, a carrier no organism that will cause nung sakit ng person. So these vectors are infected. Okay, there are the carrier of the agent. Ano ang pagkakaiba ng vectors sa agents? Okay. Okay. Ano naman pagkakaiba ng vector sa agents? Kasi ang vector, sila yung carrier, sila yung may dala. Okay. Ang agents naman, ito yung dahilan. So this is the causing organism na sila, yung agents, this is the causing organisms. Sila yung origin o nagkukos ng sakit. Okay. So, for example, the dengue virus. The dengue virus, ang causative agent niya is the virus. Okay. But, for you to be able to have this dengue, para magkaroon ka ng sakit na dengue, kailangan muna na magkaroon ka ng mosquito bites. Okay. By this infected mosquito. Hindi ka naman magkakaroon ng dengue kung hindi ka nakagat ng mosquito. Okay. So that is the vector-borne diseases. So, vector-borne diseases are human illnesses caused by parasites, viruses, and bacteria that are transmitted by the vectors. Okay. So meaning, hindi tayo magkakaroon ng sakit kung hindi tayo makakagat ng vectors. Okay. So, ang vector-borne diseases, meron silang may mga iba't ibang klase ng yung mga agents na to, may iba't ibang klase ng tinatawag na serotypes. Ano ba yung serotypes na yan? So this is a group of organisms that are characterized by a common set of antigens. Meaning, meron silang isang klase ng antigens o yung causative agents, pero iba't ibang klase lang ng itsura. Okay, kaya serotyping. For example, ang dengue, okay, very common dengue sa atin sa Pilipinas. Lalo ngayon pag sa mga tropical countries, common yung mga dengue. Okay. For example, sa dengue, ang dengue may 4 na klase ng dengue. Okay? There are 4 serotypes of dengue, 1, 2, 3, 4. Pero when you tested this virus, meron lang silang the same antigens. Okay? Pero pag describe mo siya isa-isa, may iba't iba lang silang itsura. Okay? Pero still, they are dengue virus. Okay? So, okay. Yeah. So, the diseases that are caused or transmitted by these vectors, okay, marami siyang iba't ibang diseases. So, we will just discuss some of which na very common dito sa atin sa Pilipinas. And I also included in this discussion a table of different kinds of vectors that and their corresponding diseases. Okay. So let me just discuss some of the diseases that are transmitted by these vectors. Okay. First, as you can see in this picture, okay. So this one, ano yan, nakikita nyo para siyang sugat na may mga nana. Okay. So these are um, as I think it's an arm. Common kasi yan, leishmaniasis. So this is a common form of cutaneous infections that are uh, uh, transmitted, okay, by the sandflies. Okay. This cutaneous leishmaniasis, okay, are caused by a parasites, okay, na ang tawag sa kanya from the word na leishmaniasis, leishmania. Okay, so yung mga parasite na leishmania, so madidiscuss niya, matatakil niya yan when you're in your parasitology. But for this discussion, ito, para magkaroon ka ng gantong klase ng cutaneous infection, yan, kailangan nakagat ka ng mga sandflies. Okay. So, and then the next picture, okay, yan mga nakakatakot, no? Parang photo, pero parang spider ang itsura niya. Yan, kissing bug. So this is a kissing bug that can transmit a Chagas disease. Okay, Chagas disease is caused by a parasite, Trypanosoma cruzi. Okay, so these are the parasites that carries by these kissing bugs. So once you are bitten by this kissing bug, infected kissing bug, which na meron siyang na infected siya ng this parasite na Trypanosoma cruzi, yan. Once you are bitten by this bug, posible magkaroon ka ng Chagas disease. Okay. So, by my experience, I have never seen, hindi pa ako nakakita ng gantong diseases. Okay. So, pero hindi ko nakakalimutan in my pre-med, in my practice, when na itong kissing bug, yan, very ano yan sa akin, nagmamark sa akin kasi kissing eh. Diba? So, okay. Let's move on to the next disease that can be the next vectors that can transmit diseases, that can transmit an agents that can cause a disease. Okay, so the third vectors are black flies. Okay, parang common naman sa atin sa Pilipinas tong langaw, no? Pero there are specific kind of langaw, black flies. Okay. So these black flies um carries a kind of parasites which is known as Onchocerca volvulus. Okay, so these infected black flies can cause onchocerciasis. Okay, actually, yung pangalan kasi nyo rin from ng disease, yung agents na nagkakos ng infection doon sa patient. For example, ito, onchocerciasis, yung pangalan ng disease. From that word, makukuha niyo na kung anong pangalan ng parasite. Okay, parasite, virus, bacteria. So, the onchocerciasis is caused by a parasite known as onchocerca. So, di ba, nandun yung root word. So, onchocerca volvulus. So, this onchocerciasis is, I think it also known as a river blindness. Okay. So, may mga alternative name kasi yung mga diseases na yan. Okay, anyway, let's move on to the another vectors. Ticks. Okay. Parang ano lang na, parang kuto lang ng mga aso. Diba? Kasi ako, I love pet. I have dogs. So, nung nakikita ko mga to, para, niisip ko para lang siyang ordinaryong kuto ng aso. Pero, di ba, halos pare-pares ng itsura. So anyway, so the ticks, okay. These ticks, the infected ticks, when you're bitten by these infected ticks, okay, you can have a Lyme disease, okay. So this Lyme disease is caused by a bacteria, okay, a Borrelia burgdorferi. So this bacteria, okay, carries by these ticks. Okay, when you are bitten, syempre, posible magkaroon ka ng Lyme disease. Okay. So, cheche flies. Langaw na naman, no? Kanina, black flies. Ngayon, cheche flies. Ang daming klase ng langaw. So, these cheche flies can cause a sleeping sickness. Okay. So, this sleeping sickness is common in Africa. Kaya ang tawag sa kanya, African trypanosomiasis. Okay. So, another vectors are mites. Okay, these infected mites, when you're bitten, it can cause a scab disease or bush typhus. Okay, so these are caused by a bacteria. Okay, scab typhus caused by a bacteria known as Orientia, something like that. Nakalimutan ko na specific name niya, pero yeah, it's mites. Parang siya mga parang siya kuto ng aso, no? Pero yung pala, pwede siya mag-harbor ng iba't ibang klase ng diseases. Okay. So another types of vectors, snails. Yeah. So there are several types of snails that na pwedeng maging dahilan na pagkakaroon ng isang sakit. Okay. Kaya actually ang common na carrier na kini-carry ng isang snails ay mga parasites, mga blood flukes, mga trematodes, mga worms. Yan, mga blood flukes, worms. So, kaya ang mga schistosomiasis, common yan sa mga tao na kumakain ng mga snails, ng mga suso. Okay, may iba bang term ang snails? Ang alam ko lang suso, pero iba ibang klase pala ng snails, no? So there are different types of snails that can transmit mga pag-transmit ng iba't ibang klase ng infection. Okay. So common to sa mga I think in summer, yung mga schistosomiasis kasi common sa kanila yung kumakain ng mga hindi pa well-cooked na mga suso, snails. So another vectors that can transmit disease is the mga lice, mga louse, yeah, lisa, lice. So there can cause a typhus fever, and this is caused by a bacteria, okay, that can spread to humans. Okay. So actually, uh, he, ito yung table niya, na different types of vectors with their corresponding diseases and their organisms. Okay. So, yan, another table for disease vectors that can transmit infections. Okay. So, so number 1, mosquito. So, as I said kanina, common sa atin, dengue, okay, which are, can be spread out by the mosquito. Okay. So, question, pag nakagat ba ng mosquito, infected mosquito ang person, a person, okay, can cause an illness. What if this infected mosquito can nakagat niya ang aso? Pwede rin kaya ang aso magkaroon ng dengue? Okay. So, of course, pwede din. Okay. Even the COVID. Okay. Ang COVID, ang mga animals, nagkakaroon din sila ng mga sakit. Nakatulad din sa tao. Okay. So, yan. Okay. Next. Okay. So, let me discuss about the dengue. Sino na ba nagka-dengue sa atin dito? Sa inyo, sino nagka-dengue? Mahirap magka-dengue. Very unpredictable. Actually, nakakatakot. Okay. Even a healthy person can have a dengue. Pero, yun, sabi ko nga kanina, question, pag ikaw ba ay pag ang person ba, one person, nagkaroon na siya ng dengue, posible ba na magkaroon pa siya ulit ng dengue? Of course, pwede pa. Kasi as I said kanina, there are 4 types of serotypes of dengue. Maybe the first one na nagkaroon siya the first time na nagkaroon siya ng dengue is serotype 1 o A. Then the next one na nagkaroon siya ng dengue, ibang klaseng serotype. Okay. Parang kung sa COVID naman, once na nagkaroon ka ng COVID, pwede ka ulit magkaroon ng COVID. Depends kung anong variant yung nagkaroon ka before. Okay. Kasi hindi siya pare-pareho. Yung may mga variant, the more na nag-mutate si dengue, the more na posible magkaroon ka pa ulit-ulit pa rin ng COVID o ng dengue. Kasi there are several types of serotypes. But still, dengue pa rin siya. Dengue virus pa rin siya. Okay. Minsan, may mga patient na sasabihin, Doktor, nagkaroon ako ng dengue. Ba't nagka-dengue ulit ako ngayon? Sabihin, Doktor, na pang 3 beses ko na to, na dengue. Ibig sabihin nun, yung mga previous na dengue mo, iba't ibang klaseng serotype. Kung nagkaroon ka ng 3 beses na dengue, meaning, the last time na magkaroon ka ng dengue, kumpleto ng iyong antibodies. Okay. So, you have 3 antibodies against 3 serotypes of dengue. So, we have only 4 serotypes. So, once you have 3 out of 4 dengue, so, ibig sabihin, may isa ka na lang na absent ang antibody against that specific serotype. Okay. So, let's move on to the dengue. Okay. Actually, I love this slide kasi everything andyan na. Okay, about what is dengue virus. Okay. So, dengue virus is a family of Flaviviridae. Okay. So, it is transmitted. It is a disease transmitted by a vector. So, ito ay isang sakit na magkakaroon ka na ng gantong sakit kung ikaw'y makakagat ng isang vector, specifically isang lamok. Okay. Anong klaseng lamok? Anong klaseng vector? So, Aedes aegypti. Okay, I love this, this slide. Kompleto na siya. So, ayan. Saan common ang dengue? Ayan, Asia, South America. Ayan, mga tropical, lalo sa mga tropical countries. Okay. Paano ka magkakaroon ng dengue? Yan. Discuss yan sa dyan, kanyang pathophysiology. And then discuss niya, what is dengue? Okay. So there's different classifications of dengue. It can be dengue fever, hemorrhagic fever, and shock, hemorrhagic shock. Okay. So, but still, ang kanyang clinical presentation. Okay. So, yung classification kasi ng dengue, iiba-iba lang yan. Depende kung ano ang clinical presentation ng patient. Okay. So, pag sinabing dengue fever, this is just a mild dengue. Then, pag sinabing dengue hemorrhagic fever, from the word hemorrhagic, so may kasama na siyang bleeding disorder. Okay, bleeding problems. Then, kapag sinabing dengue hemorrhagic shock, may bleeding na siya, nagsha-shock pa ang patient. So, ito yung pinaka-severe form of classification of dengue. Okay. So, ayan, pinakita rin sa slide niyan kung paano rin i-diagnose, okay, and treatment. So, unfortunately, there is no antiviral therapy available at the moment against dengue. Supportive pa rin. Okay, increase body fluid, fluid intake, inom pa rin ng maraming tubig, yan, hydration, kasi virus yan eh, so supportive lang ang management, walang antibiotic unless merong kasamang complications yung dengue, like pneumonia. Okay. So, eto. So, what is dengue? So, dengue is also known as breakbone fever. As in, kaya siya tinawag na breakbone fever. Yung patient, parang nakakalas ang kanyang mga buto. Literally, ganun siya. I-describe ng mga pasyente nagkaroon ng dengue. Para daw nakakalas ang kanilang mga buto. Meron nga akong patient before, kung maglakad siya, I thought it was appendicitis. Kasi talaga hindi siya makalakad na masakit ang kanyang buong katawan, masakit ang tiyan niya. So, yun pala, at the end, dengue pala. Talagang breaking bone, kung tawagin. So, this is a severe flu-like illness. Parang COVID, flu-like illness that can affect all ages. Ganun din, di ba? Parang COVID. But the difference between the COVID and the dengue, that ang dengue can be transmitted by the bite of a mosquito. And while the COVID, ang transmission niya ay human to human. Okay. So ito yung itsura nung mosquito ng Aedes aegypti. So this is a female type of Aedes. Okay. Minsan kapag nakapatay ka ng lamok, tingnan nyo kung may mga zebra. Ang tawag nga sa kanya zebra color ng skin. Kasi parang siya may stripes ng white. Yan. So this is, in some time, this is a public concern kasi nga very drastic, very severe pag nagkaroon ka ng dengue. So once na nagkaroon ng warning sign, yan, talagang nakakatakot. Okay. So, but this dengue is preventable and can be controlled. Okay. So, pero bakit hanggang ngayon hindi natin ma-prevent? Ang taas pa rin ang cases natin. Okay. So, okay, this is this is just to show you the life cycle of a female mosquito, Aedes aegypti mosquito. Okay, once they lay eggs inside the containers holding stagnant water. Okay. Ang sabi nga nila, yung mosquito daw kasi na specifically the Aedes aegypti, love niya yung stagnant water. Hindi lang siya stagnant water na makikita mo sa kanal. Okay. Kailangan ano siya, a clean, stagnant water. Okay. Lalo na nakikita sa mga gulong. Yeah. So, ano yan, that's true. The Aedes aegypti mosquito, they lives in a clean, stagnant water. Okay. Actually, do sa bahay namin, yung mga vase namin, mga halaman namin inside the house, kasi clean water yun eh. So, knowledgeable ako kung kung saan nakatira, kung saan makikita ang mga Aedes aegypti. So, ginagawa ko to sa vase namin na may clean, stagnant water. Nilagyan ko siya ng oil. Okay. So, para at least, kung magkaroon, tsaka kung may oil, hindi basta-basta makakaalis yung mosquito from the water. And then, I make sure na yung water, every other day, napapalitan siya. At least kung merong egg doon ang mosquito, na-wash out siya. Okay. So, ayan. Bakit female Aedes aegypti lang na mosquito ang pwedeng mag-harbor o magkalat ng dengue disease? Okay. Why only female mosquito can transmit the dengue virus? Okay. So this is why, the reason why. Because the male mosquito feed on nectar from flowers, while the female mosquito feed on humans and animal blood to produce eggs. Okay. So, ibig sabihin, si babaeng lamok lang ang nangangagat sa atin. Okay. Yung mga lalaking lamok, ang kinakain nila kasi yung mga nectar. They're so sweet. So let's move on. Okay. Yeah. Yan, the lamok develop to pupae as little as 5 days hanggang sa maging kiti-kiti, and then maging adult flying mosquito after 2 to 3 days. O, diba? Kaya that's why yung ating mga flower vase sa bahay, o even yung mga stagnant water natin, dapat every 2 days napapalitan para yung egg na store doon is ma-wash out din. Okay. So, yan. Ano ba ang dengue virus? Okay. So, na-discuss na natin yung carrier ng dengue virus. Okay. So, ano ba yung dengue virus? So, let's talk about naman yung agent that can cause dengue disease. Okay. So, dengue virus is a small single-stranded RNA. Okay. RNA virus with a serotypes of dengue 1 to 4. 4 na serotypes. So, meaning, iba-iba rin yung antibodies niya. Okay. Pero, isa lang antigen niya. So, again, this is belongs from the family of Flaviviridae. So, the dengue 2 genotypes, ito yung common sa Asia. Okay. But, the dengue serotype 3, ito naman yung pwedeng maging dahilan ng severe infection. Okay. So, as you can see in the picture, there are 4 different types of serotypes. 1, 2, 3, 4. But still, yan, they're still a dengue virus. Okay. So, ano ka ba magkakaroon ng dengue? Okay. So, this is the pathogenesis. Paano ka nagkakaroon ng dengue at kung bakit ka din nagkakaroon ng iba't ibang klase ng simptomas. Okay. So, the uninfected mosquito, Aedes aegypti mosquito, uninfected ha, once this mosquito bites a person with dengue infected person. Okay. Itong mosquito na to, pag kinagat ka at ikaw ay meron kang dengue, magkakaroon din, may infect si mosquito. Okay. So, ibig sabihin nun, hindi lang si mosquito ang dahilan bakit ka nagkakaroon ng infection. Si mosquito rin. Nai-infect din siya. Since mosquito bite a person with dengue, okay, so magiging carrier na si mosquito ng dengue virus. Okay, the mosquito will ingest blood with dengue virus infection and it will take 8 to 10 days for the dengue virus to incubate. Okay, hanggang sa maging mature yung incubation niya. So it will take at 8 to 10 days the dengue virus for incubation. So this infected mosquito, dito na yan. So, this infected mosquito, yan, this infected mosquito, kakagatin naman niya yung healthy person. Okay. So, pag kinagat ni infected mosquito, si healthy person, ano mangyayari? So, matatransfer ni infected mosquito yung kanyang daladalang virus doon sa healthy person. So, that will be the time na mai-infect si healthy person. And then, yung person na nakagat ng mosquito na yan, after 4 days, makikita na ang mga simptomas ng dengue infection. Okay, magkakaroon ng mataas na fever, masasakit ang mga buto-buto kasi nga flu-like infection. Okay. Severe headache, nagsuka, masakit ang tiyan. Yan. Skin rashes. Okay. Pero yung mga rashes na yan, nakikita yan. Okay. In a few days. Okay. 4 days after from the peak of fever. Okay. So let's move on. So there are 3 clinical presentations of dengue infection. So febrile phase, critical phase, and convalescent phase. So, okay. Yan yung mga iba't ibang stages ng dengue. Okay. So, okay, mamaya may papakita pa akong ano. So, as you can see in this picture, yeah, pinakita rin dyan yung changes ng temperature on the first day. Pagkakaroon ka ng fever, high-grade fever as high as 40 degree centigrade. Yan. Common yan sa mga dengue. Okay? And then, on the between third to fourth day of your on and off fever, high-grade fever, yan. Then, kaya kasi nagkakaroon ng fever, kasi tumataas yung viral load. Meaning, yung virus, mataas yung numbers inside your cell, inside your body. So, your body cells, okay, since mataas ang viral load sa katawan mo, yung iyong mga immune system, yung mga immune cells mo, lalaban yan against that virus, which will cause fever. Okay. And then, kapag bumaba ang fever mo, ibig sabihin na, bumaba din yung number ng viral load mo inside your body. Okay. Pero that will be the time na tinatawag na critical phase. Okay? Kasi, dyan mo dapat i-observe yung mga 7 warning signs. Okay? Naalala ko, nung nagka-dengue yung son ko, talagang halos di ako natutulog on the 3rd to 4th, 5th day. Talagang ina-observe ko yung mga warning signs. Dyan na once na bumaba na ang fever mo, bababa din ang viral load. Okay? bababa din kasi ang mga platelet, okay? Yung mga dugo mo, lalo na platelet. Okay? Kasi sinisira yan ng dengue virus, yung mga platelet na yan. So, on that day also, on the third to fourth day, so since nasira na yung mga platelet mo, yung mga ibang cells mo, kaya nga bumaba ang iyong lagnat kasi nga nasisira na rin yung mga immune system cells mo. Okay. So, dyan tayo nag-start yung mga critical warning signs. So, observe on that. Okay. So, let's move on to, try to discuss each of these phases. Ayan. The febrile phase, febrile, kasi dyan talaga yung peak ng lagnat mo, mataas na lagnat, as high as 40 degree, kasi mataas. That can cause you a severe headache, muscle pain, joint pain, yan. Kaya siya breaking bone. And then, dyan na rin mag-start yung mga petechiae. Yeah. And that will also cause a positive tourniquet test result. Okay, mga petechiae, makikita nyo reddish, small maculopapular rashes. Yan. So, meaning kasi nag-start na dyan, bumaba ang iyong platelet. This will be on 2 to 7 days. Yan. So, the next phase is the critical phase. Okay. This critical phase lasts for 24 to 48 hours after your febrile phase. Bababa na dyan ang fever mo. Okay. Kasi nga, bababa na yung viral load. Yun nga lang, bababa din yung mga platelet count mo. Magkakaroon ka ng mga pagdurugo. Kasi nga, mababa na yung platelet that can use sana for coagulation, for platelet plug. Kaso nga lang, wala kang platelet. So, tendency mo, magbi-bleed. Okay. So, dyan ang mga symptoms na lalabas yung mga hemorrhages, mga bleeding. Yan, yan tawag na hematemesis, magsusuka ka ng dugo, hematochezia, na may presence of blood to si stool. May kita nyo pa nag-CR ka, nagpupo ka, may kita mo, may strips ng blood. Yan. So, menorrhagia, okay. Excessive menstrual bleeding. Hindi mo alam na, akala mo lang it's just an ordinary monthly period, pero excessive bleeding. Okay. So, dyan din, hindi lang vomiting of blood. Nandiyan din yung mga, may kita nyo presence of gum bleeding, nose bleeding. Yan. Kasi nga, bakit ka nagkaroon ng bleeding? Kasi nga, bumaba ang iyong mga platelet count. Okay. So, yan. Nose bleeding. Yan. So, let's move on to the last phase, the convalescent phase. So, this is the resolution of symptoms. Sabi nga, may picture, masaya siya. Yeah, kasi this is my last phase, convalescent symptoms. So, enjoy kasi that will be the start of the day na mag-normalize na ang mga blood test mo, especially increasing in numbers of your platelet count. Okay. So, very, talaga, yung timeline na to from the febrile hanggang convalescent, ganyan na ganyan. I hope some of you na nagkaroon ng dengue, to try to recall these phases. Okay. So, yan, totoo yan. Magiging masaya ka talaga kapag nasa convalescent ka na, once makita mo yung platelet mo tumataas na. Okay. So, yan. Plasma leakage is a process in which the protein-rich fluid component of the blood leaks from the blood vessels into the surrounding tissues. Okay, ito yung pathophysiology kung bakit ka nagkakaroon ng dehydration, mga organ failure, mga bleeding disorders, pag meron kang dengue, kasi nga nagkaroon ng plasma leakage, lumabas yung fluid component from intracellular to extracellularly. Okay, that will also cause Um, um, yung ibang patient, talaga nagkakaroon ng mga renal failure, nagkakos pa ng, ng dialysis sa kanila. Okay? So, kaya that's why kanina I emphasize na kasi ang dengue um, wala siyang specific medicine or drugs against the dengue virus. Ang management lang ng dengue ay supportive, meaning just give body fluid, increase fluid intake, yan, para ma-rehydrate ang patient to avoid dehydration kasi nga, nagkakaroon ng plasma leakage, lumalabas yung fluid intracellularly. Okay, pupunta siya from intracellular to extracellular. So, magkakos ng dehydration. So, para ma-avoid ang dehydration na cause ng plasma leakage, kailangan i-increase mo rin yung fluid intake. Okay. Okay. Yan. So, there are several classification of dengue, the old times and the new one. Okay, so, dati, classification lang graded by 1 to 4. Pero now, by WHO classification, it can classify it as a probable case, a warning sign, dengue with warning sign, or severe type of dengue. Okay. So these are the 7 warning signs. These are the 7 warning signs na kailangan i-observe. Actually, ang dengue naman, pwede naman kasi sa bahay lang, home management, home medications, home management. Pero, kaya nga mga pasyente may dengue, pinapauwi din namin. Pero, we make sure dapat na they know what to be, dapat alam din nung relative ng patient, ano kanyang i-observe na mga warning signs. So, pag nakita nila itong warning signs na to, ina-advise namin sila na pumunta sila sa hospital for admission. So, they need to be admitted kapag may ganitong warning signs. Okay? Severe abdominal pain. Kasi baka mamaya meron siyang internal bleeding. Okay? Vomiting. Magkakos na silang dehydration ng vomiting. That's why kailangan iswero. Edema. Excessive edema sa lower legs. Yan, ibig sabihin nun, masyadong maraming plasma leakage. Hindi niya ma-excrete from his body. So, baka kailangan i-dialysis. Weakness. Liver enlargement. Decrease in platelet that will cause to bleeding. Okay. So these are the different dengue warning signs na kailangan i-observe na admissible. Kailangan i-admit. Okay. So yeah, bring to hospital. Kaya on the 3rd day of after peak of fever, ito na dapat i-observe ninyo. Pag may nakita ka ng ganyan, go to the nearest hospital. Okay. So, this is the severe dengue, where it is defined as plasma leakage that may lead to shock. Yes, pwede mag-shock. The severe bleeding and organ impairment, kaya nagkaroon ng shock. So, these are the different types, iba't ibang klase ng test, laboratory tests na ginagawa para ma-determine kung may dengue ang patient. There are the screening tests, okay, the confirmatory tests na tinatawag, common na ginagawa dito sa atin sa lab is the confirmatory tests na. Okay, ang mga screening tests, actually, hindi na siya talaga ginagamit as of today kasi we have this confirmatory test. And then what we do for the screening test is we ini-interview ang patient. and then the sign and symptoms. Okay. Kapag kasi ang patient may ganito ng sign and symptoms, automatic for confirmatory test na. Okay. So then and then kung mataas kasi ang cases natin ng dengue, the probability na dengue to is mataas. So, diretso ka na sa confirmatory test. So there can be dengue NSA antigen or the IgG-IgM. Okay. Pero in the lab, once you request for a dengue test, automatic yung tatlo na yan. The antigen and the antibodies, the IgG and IgM. Okay. So, but the gold standard test for the dengue, of course, PCR. Pero mahal kasi PCR. Okay. And the uh, dengue reduction neutralization test. So, they're very expensive tests. Kaya hindi siya ordinary na nire-request. Routinely requested in the laboratory. Okay. So, let's move on to the screening test of dengue. For example, nandun ka sa malayong lugar na probinsya. Wala ka naman doon hospital na madalhan. So, for you to check kung ang patient na to ay may dengue o relative mo na to ay may dengue. Kasi nagko-complain ng high-grade fever, masakit ang tiyan, masakit ang ulo, nagsuso ka, ganyan. So, think about it, baka dengue. So, para ma-check mo kung dengue siya, you can do tourniquet tests. Okay, so this is type of a screening test. Tourniquet test. You just need to put an instrument, yan, as indicated in the picture, and then check for the presence of the PTK in the area. Okay. So, let's move on, yan, to the management. Yan, hydration. Number 1 talaga, hydration. Because the pathophysiology of your dengue is ang kanyang main reason ba't ka nagkakaroon ng iba't ibang sign and symptoms kasi may plasma leakage. So, kailangan mo ma-hydrate to relieve the symptoms. Okay. And then, syempre, pag mga severe type of dengue na, and then when the platelet count is very below the normal level, so, kailangan mo na ng blood transfusion. Okay. Which is very risky. Okay? Ang magkaroon ng blood transfusion. So let's move on to the second type of disease or illness that are caused by a vector. Okay, the Zika virus. So this Zika virus, okay, yan. Ang ganda rin ng ng slide na to. So mga infographic slides that you can see in the internet. Okay. So ang cute niya. Okay. So yan. It show here that the Zika virus is also caused by a vector. What kind of vector? Mosquito. Okay. So it can also affect both sexes, the male and the female. And the sign and symptoms, fever, rashes, headache, red eyes, muscle pain, joint pain, bone pain. Parehas ng ng dengue. Okay? Parehas din sila ng dengue because of their vector are mosquitoes. Okay. So, pero itong Zika virus kasi, okay. Yan, as you can see, there is a pregnant woman in this picture. Okay. Kasi itong mosquito na to, Zika virus, when they infect the mother patient, a woman, childbearing woman infected this Zika virus, there's a high probability that her baby might have a problem on the brain, as the size of the brain, maliit, microcephaly. So, yan ang very particular sa Zika virus, unlike in the dengue. So, the dengue, number 1 common denominator niya ay bleeding. Yun. The nag-start yung talaga severe infection, sign and symptoms niya is the bleeding. Unlike in the sequelae of the dengue. Unlike in the Zika virus, yung kanyang talagang yung target is a very particular pala sa kanya na nata-target and effect is yung when the baby was infected is nagkakaroon ng microcephaly. So once we know their transmission, same as well with the dengue. Alam na natin kung paano tayo nagkakaroon ng dengue, Zika because of the mosquito. Okay. So, alam natin dahilan, alam din natin paano natin mapiprevent. Okay. So, how can we prevent this type of virus? So, tanggalin natin ang mosquito. How? Siyempre, linisin natin ang mga paligid. Avoid natin yung mga tinitirahan ng mga mosquito. Okay. Kaya nga, yung mga, yung sa mga health center, okay, yan, lalo na kapag peak season ng dengue, very active yung mga health center workers natin. Okay. Kaya minsan nagbabahay-bahay sila just to remind the homeowners to clean up their areas, to remove the stagnant water because dyan kasi nakatira yung mga kitikiti. Okay. So, use of mosquito net. Yeah, spraying anti-mosquito agents. Okay. Let's move on. Yeah, the Zika virus. Actually, the Zika virus transmitted by the same as with the dengue na Aedes aegypti. The same. Okay. But yun na lang, severe ang kanyang effect to the woman child bearing can cause a microcephaly. So para sila, Aedes aegypti, Aedes mosquito, the same with the dengue virus, RNA virus from the family of Laviviridae. The incubation period is 3 to 14 days. The symptoms of dengue and Zika. Rashes, fever. Yan. Paano ba natatransmit ang Zika? Pwede ba siya ng human to human? Meron kasi tayong tinatawag na vertical transmission from mother to baby. Okay? But primarily, pwede rin siyang blood transfusion ang Zika virus. Pwede rin sexual intercourse. This is the difference. Okay. These are the difference between the dengue virus. Okay. So the dengue virus literally is caused by the dengue virus transmitted by infected mosquito. Unlike in Zika, there are at least three mode of transmission. Vertical transmission from mommy to baby can be transmitted to other human through blood transfusion and as well as safe sexual intercourse. Okay. Yan. Zika transmission, the mosquito bite, the mommy, and then when the pregnant patient is infected, the virus can be transmitted to baby. So the Zika virus can be transmitted human to human. So the baby will develop birth defects. So these are the birth defects of the baby when they're born. Actually, I have a case of this it's not micro, anencephaly talaga. Wala siyang brain. Meron lang siyang skull, pero wala siyang brain. Anencephaly ang tawag sa kanya. So I have this autopsy before. Okay. So usually it is asymptomatic but may fever, headache, body pain, rashes, complications, neurology. Okay, microcephaly. So there are some diagnostic tests can be used to detect this kind of virus. Okay, but Culturing the virus is not generally used or done in the laboratory. Okay. So, since this is RNA virus, the best way to to determine this type of virus is through PCR. Okay. Okay. Pero pwede rin gawin sa kanya yung sa mga chronic phases, yung mga ah ah antibody testing, IgG, IgM testing. So, how do you prevent the Zika virus? Of course, kung alam natin ang cause of the virus, so probability na how to prevent of getting that virus is alam din natin. So if it is came from the mosquito, it's transmitted from the mosquito, it can be transfused by, can be can be transmitted through blood transfusion or unsafe intercourse or sexual intercourse. So kung ganun, you have to be protected. Diba? So you have to use anti-mosquito repellent, screen the house, and have a safe sex intercourse. Okay. So and then be updated and learn about the virus. So let's move on to the malaria. So the malaria is another type of a vector-borne disease. These are the signs. Is transmitted by the infected mosquito. Through yan, yung mga signs symptoms. You can have vomiting, fever, cough, headache, nausea. Viral, ano pa rin, no? Flu-like symptoms. So this is a malaria. Mosquito. Okay. So this is the forms of passion, talagang sing below. Trophozoite, schizoid, and dermatocyte. So these are the different stages or species of malaria. So iba-iba yung tsura nila sa microscope, under the microscope, and then this is also used for us to diagnose. So, okay. Para malaman paano ma-prevent kung ang magkakaroon ng ganun sakit. Para, yan. So, knowing all of the life cycle, kasi para magawa. So, okay. So, ano lang dito, it is a very broad discussion about the life cycle of the malaria. Pero just wanted to emphasize in this life cycle is the stage, the infective stage. Okay. Infect the of human, okay, as shown in the picture is the okay, na infectious doon sa human. Okay. Okay. Sige. So, together with some of the different types of because kasi masyadong malalim ang discussion ng life cycle nito. So, it will be I just wanted to emphasize the effective stage of the of malaria to human is the sporozoids. Yung yung uh, mosquito stage in the mosquito na nai-inject doon sa na-transfer doon sa human. Okay, that will get yan is yung liver. Okay, so it will can cause a different type of sinus symptoms. So meron kasing tinatawag na okay na cycle yun sa life cycle. It can be exo-erythrocytic cycle. Then the second is the erythrocytic, meaning or within with and then the third cycle happens outside the RBC. So the infected mosquito will inject the sporozoid into the human host, and this will infect the liver cells and mature it into schizoids. So, yan, sporozoids pumasok dito sa liver, then yan, uh, will enter into erythrocyte cycle kasi na-infect na niya ang RBC. So within the RBC, the merozoites will inject the RBC and kakaroon ng immature trophozoites. So from the merozoites, magiging trophozoites na yung pieces, the exoerythrocytic cycle, erythrocytic cycle, and the sporogonic cycle. So the trophozoites mature, magiging microgametocyte, magiging macrogametocyte, um, and then, yeah. So if a new, okay, talking about the erythrocytic cycle, if a new Anopheles mosquito feeds on the human host, ito yung mga uninfected, she will ingest the micro enter the sporogonic cycle. Sporogonic cycle happens inside the mosquito. Okay. So, yeah. So, inside the mosquito happen the sporogonic cycle. And the old way of diagnosing the malaria disease is through thick and thin smear. Okay. So and a rapid test also available in the laboratory. Okay. But specifically, we use the thick and thin smear if we wanted to classify of what specific stage or what specific malarial infection. We use the thick and thin smear. Okay. Para ma-check namin kung anong klaseng malaria parasites ang nag-cause ng infection. Maybe vivax o vale. So, depend doon sa itsura ng parasites within the cells of the RPC. So, can be microscopic or rapid testing. So, ito yung may kita nyo kapag sumilip kayo sa thick and thin smear. Okay, may kita nyo kasi kung klase ng malaria parasite. Vale, falciparum, vivax, yan. Iba-iba itsura niyan. So, we use this microscopic examination to determine specifically kung ano talagang malaria parasite present. Okay. So, that's it. Okay. I hope you learned something new, something different. Okay. I hope it will help you to discuss. And yeah, that's it. Thank you. Any questions? Any questions? Yes, Rafael. May question?
Ma'am, ayan po ba yung mga common diseases dito sa vector-borne diseases dito sa Metro Manila?
Common talaga yung dengue, even outside Metro Manila. Malaria, common yan sa Palawan. Okay, pero very, bihirang-bihira. Okay. Ano pa? Ang dengue, once na nagtag-ulan, rainy season, expect nyo, ang daming dengue cases. Ano pa? It can be leptospirosis, pwede din. Diba? Pero, ang discuss ko lang is the dengue, the Zika, and the malaria because these are we have the same vector mosquito. Okay. Ano pa? Any questions? Lana? There's no more questions? So, thank you for listening. Happy weekend.
Thank you po, ma'am.
Okay, salamat.
Thank you po.
Thank you, Doc. Thank you po.
Wait lang po, ma'am. May question po ako. Hello? Ma'am, common rin po ba yung lymphatic filariasis